Welcome back to McLaren Port Huron's Today's Health Program. Today we're talking about Parkinson's disease. Joining me now is Jessica Zirnis, Doctor of Physical Therapy at McLaren Port Huron's Lexington Physical Therapy. Jessica, welcome to the program.
Thanks for having me.
Now you work as a physical therapist. You work with a lot of patients with different physical disabilities, but what treatment options are available specifically for persons with Parkinson's disease?
Patients with Parkinson's disease, they can come in with an orthopedic condition, shoulder, low back, just like anybody else. But then they also, a lot of times when they go see their doctor, they're complaining that they're walking slower, they're not keeping up with their friends, they have more difficulty with activities of daily living, getting dressed, bed mobility, and those slower, smaller movements, that hypokinesia, bradykinesia, those are the things that we can work on with LSVT.
Can you expand on that and tell us what LSVT is?
LSVT is a high-intensity amplitude-based exercise program. It works on with the amplitude, the bigger movements, the greater range of motion. The mode, it's high intensity, it's high effort exercise. The recalibration of it is that getting those big movements to come over into the rest of the activities of daily living.
So with the big movements then, does that kind of retrain their brain to help them with the smaller movements that they're having difficulty with?
Yep, that would be the neuroplasticity of it, where the brain accommodates and it adapts to these new physiological movements, and LSVT does that with specificity. We're working specific on the smaller movements, and the smaller and slower movements, trying to get them to be faster. And then the salience, we want it to be something that's important to the patient, and then timing, complexity, all of those are LSVT.
How often can this treatment be done?
This treatment is done, the patients do it every day. They have, we go through a whole exercise regime. It's for the original protocol that we do at the clinic is for a month, and it's 4 times a week. And then they work on, there's 7 standard daily exercises, then we have some functional capacity exercises that they work on that are just specific on what they need to work on. And then we work on big walking when we're there, and then they carry over those exercises they do them twice a day forever. And then what we do is we expect after about 6 months after they've left the clinic and then they've had a recheck with their doctor, a lot of times they'll get another prescription just to come in and do what's called a Tuneup, so that we know, hey, is everything still going well? Are they still doing the exercises appropriately? Are their exercises still appropriate? And then, is their gait still going well? How is their balance? How are they doing with their activities of daily living? Is there anything that we kind of need to change up on that?
So after they complete their program of this exercise, do they go home and then practice those exercises at home after that?
Yeah, they do them once at the clinic with us, and then they'll do them, and that's from day 1, the first initial eval, we get them started on that, and then they go home and they'll do them again. And then the next day, 4 times that week, they come in for therapy and we do them, and the exercise is there, and then we do them again then they do them again at home every day.
Now, for those who are interested in having the LSVT therapy, is there a prescription or a referral that's needed for that?
Yep, they get one from their doctor. A physical therapy prescription that says LSVT on it. It doesn't have to, it just says eval entry, but LSVT is great.
And how would somebody get a hold of you if they were interested in learning more or making an appointment?
Yeah, they can call me at McLaren Port Huron Physical Therapy. I'm at the Lexington site. Our number is 810-359-8193. They can call us and we can get them an initial eval.
Jessica, this has been great information. Thank you for joining us today.
Thank you. It was wonderful.
Stay with us. We'll be back after a break.